We continue our study of viral infections of the skin, and the population that is vulnerable to molluscum contagiosum are children and people who are immunocompromised, people with HIV/AIDS. This papule is said to be a clear dome. This is the description of what you're seeing in the picture, a clear dome that tends to have a core to it, or actually described as an umbilical kind of depression in the center of it, filled with pus, and quite contagious. Contagious when it weeps. So when a papule is broken, then this can be communicated to other people. This obviously needs to be, when a person is infectious, they need to be sequestered. So no wrestling, no hanging out in the church nursery, playing with the common toys and so forth and so on. And it's possible to do curettage where these are removed mechanically. Otherwise, the virus has to run its course. So molluscum contagiosum. And then, as indicated on a previous video, pink eye can be viral. And really, it just needs to run its course. The bacterial version of pink eye can be more destructive, and so really needs antibiotics. So, and then inflammation of the skin. Let's decide together that the suffix means an irritation to, and itis means inflammation. The body reacts to irritation by becoming inflamed, and some of those irritations are things we're allergic to. So in atopic dermatitis, it causes roughened skin. It's clear that this is irritated. Could be one exposure or multiple exposures. And if someone's allergic, for instance, you go to any healthcare facility, signs all over the place. If you're allergic to latex, let us know. So latex, I'm pretty sure, is being phased out because honestly, if you slip on a pair of latex gloves and have that allergic reaction, it can be very immediate and disconcerting, and the pruritus that comes from it is uncomfortable. And then another manifestation of hypersensitivity is eczema. The care for this is to find out what you're allergic to. My way good high school buddy got a pet monkey, and within 10 days, the antecubital fossa in his at his elbow was broken out like this, and it was just a pity that they didn't. My friend was allergic to him and had to find him a new home. And then psoriasis is a type of dermatitis, genetically predetermined, and kind of problematic because we're not real sure. It's genetically communicated. It's responsive to stress. It manifests more when it's stressed. And really what this is, skin that is cycling through too fast. It's exposed to the surface before it's ready, and it's uncomfortable, and the cosmetic effect of this is to make people shy. Not unusual to be found on different parts of the body, on the extremities. And the care of this, using petroleum products to try to minimize it and to do stress management, or I'll just say stress management. You can read more in your text about care treatment. There are medical doctors, dermatologists, who spend their entire career studying this because it's widespread enough and it causes such grief for the people who have it that there's some new things in the fore on how to treat it. And then contact dermatitis. This is where you touch something. I use that as an example here in atopic dermatitis, but this person had very small amount of exposure and the skin reacts to it. dramatically. And then I think you picked this up in your first aid studies, the different kinds of breaks in the skin where there's a jagged break in the skin, laceration. An incision wound is where a force is applied. This is not an unusual place, playing basketball or horsing around or whatever, and you take a blow here and it causes a straight line injury, but because of the elasticity of the skin, that straight line break results in the incision wound being like a smile. And the solution to this is very simply draw those edges together, make sure that it's treated for it needs to be cleansed so that we're not putting Staphylococcus aureus into there. And then abrasion to the skin, you're very familiar with this. And then puncture wound. This is a football game being played at the University of Georgia, Alabama. This guy scored a touchdown, and UGA, I don't know which number, UGA, took exception to this guy scoring and bit him right there and introduced bacteria into that man's skin, and that can lead to pretty serious bacterial infection. Both extreme heat and cold can break the skin barrier, and so you see the third-degree burn. The skin barrier is broken. Infection is a major threat in third-degree burns in particular, and second-degree burns where the blistering can open, and that can be a portal for bacteria. So we need to be aware that those need to be treated in a sterile fashion. And then wanted to talk to you about eschars, or we call them scars. Over scarring, way overshoot of scarring is a keloid scar. You can see this person probably had an abrasion here, and it just really over-scarred. Not to be differentiated. Actually, a smaller amount of scarring is hypertrophy, hypertrophic scar or healing. And then when the scar, this is man's a burn victim, and because of the loss of elasticity, this person begins to experience contracture. And in the very, very large area involved here, there'll need to be a surgical release and skin grafting so that this he won't lose the use of the limb because of the reduced range of motion. You know about this chronic inflammation in the pinna of the ear. And initially, the treatment for this is when there's been a great deal of rubbing here. Contact sports like boxing, cage fighting, wrestling, lots of rubbing. Well, you have to put a pressure dressing in there to keep this from filling in. What happens is the inflammation begins, and then there's interstitial fluid that invades there, and then chondroblasts come here and form a solid scar. Some people use this as a badge of courage for them, but some people this would be a bad thing, and so difficult to get rid of once you have it. So the way to do it is to prevent it through ear covers, and then if there's a big incident of friction, then there needs to be pressure put into this, bound, and let the skin heal to the cartilage. And then infestation of scabies and lice, pediculosis. Lice have invaded here and are breaking through the skin, and secondary bacterial infections can happen. I think you probably somebody says, "What is this?" and it's in these crevices of the body, maybe in the axillae or the groin, or in the flexor portion of the body, behind the knee, in the elbow. These need to be eradicated because of the threat of bacterial infection. And then we move to cancer. The big bad daddy, the one that needs our attention, is malignant melanoma. This is one of the most virulent cancers that mammals can have. That's you and I. This is a cancer that has to be caught early and treated early so it doesn't metastasize. That's what we mean by virulent. it can it can progress very quickly to metastasis in the skeleton, into the nervous system, and yeah. Less virulent are the basal cell carcinoma. You can see the manifestation of this. Well, you see that in your dad or a buddy, somebody at church, and somebody that you can talk to about it and say, hey, tell me about what's going on with your skin there. Have you seen the skin doctor about that? Maybe we ought to, that's looking interesting. Maybe we ought to have that checked out. And then squamous cell carcinoma. These, particularly basal cell, very slow growing, don't tend to be invasive unless they're just never treated. Squamous cells a little bit more aggressive in terms of moving deeper into the tissues, doesn't have a tendency to metastasize widely like malignant melanoma. And then Kaposi's syndrome is associated with immunocompromised patients who have HIV/AIDS, almost exclusively with the immunocompromised. And then because malignant melanoma is such a big deal, we have to spend time. In fact, in lab, we will replicate these images such that you really, you have to have walking around knowledge of this. The ABCDs of malignant melanoma, asymmetry. If you fold it over, it's not going to form a half a circle. It's asymmetrical. The borders are irregular. The color will be varied across the melanoma. So it'll be light and dark and in between. And then the diameter, anything larger than the end of a pencil eraser, that's got to come off. Okay, and any tissues that are deep to that. And then actinic keratosis and seborrheic keratosis and nevi are precancers. We need to watch these and be treated, because if they begin to change shape, color, size, it could be progressing to a cancerous circumstance. Again, we'll deal with that in greater detail. And then the autonomic skin conditions we've talked about, systemic lupus erythematosus. Here's the characteristic butterfly rash, and darkly pigmented people are more vulnerable to SLE than more fair people. And then discoid lupus is very local. It's like a very shallow bowl, or if you took a U.S. coin, you see the edges are raised and the inner part of it is a little depressed. This is multisystemic, therefore its name. This is focal. And then systemic sclerosis is where the tissues become tight, rigid, and can interrupt the functions of kidneys, intestines, the cardiac system. This is a manifestation of systemic sclerosis in the hands. And then autoimmune skin reactions, reaction to cold. You can see that this person was iced right here, and the skin is raised, and there's a reaction to that with increased tissue fluid. Solar response, and then allergic response. Okay, and then pigment changes in the skin, usually benign, but vitiligo, changes in skin color. There's a lack of pigment here that needs to be monitored to make sure that it's not moving into another realm. And that will do it. Thank you. Bless you. Be students of the skin. All right. Bye.